Yorkshire Cancer Research funded the Leeds Lung Health Check because we knew that lung cancer was a big serious problem in Yorkshire, and we knew that lung cancer was responsible for the most cancer deaths in the county. It was a great test of also putting things into a mobile van and driving it around to the places of need so that people could access it more easily. So over the last 5 years, we've added to the trial as we've gone along, and so in total it's been a really significant success.
The lung health check involves a quick CT scan, and that can show early signs of lung cancer. Screening people at higher risk of lung cancer before they experience symptoms means that we can detect lung cancer at an earlier stage where there's more treatment options and a better chance of cure. The programme will play a key role in tackling health inequalities by improving survival rates in communities more affected by lung cancer, both in Yorkshire and across the country. In the 5 years that we've been screening, the Leeds Lung Health Check has screened more than 8,100 people for lung cancer. Of those people, we found almost 350 lung cancers. Of those cancers, most of them at an early stage where there's more treatment options and more chance of cure.
Further down the line, we added kidney screening. So by using the CT scanner to just track a few more centimetres further down the body, we could identify early tumours in kidneys as well. The trial has gone from strength to strength. It's had international acclaim, it's won awards, it's been lauded as a fantastic trial that has contributed to the global evidence on lung cancer, but nationally it really helped to convince people that the national rollout was the right thing to do.
So I never expected to get the result I did. I didn't have a cough, I didn't have a cold, I never had anything. I was quite fit.
I didn't realise that I had stage 1 cancer. I was fit, I was healthy, active. I had no idea until, fortunately, I was in this scheme. I was scanned, it was discovered, picked up very early. I was operated on successfully. I don't feel that I've had lung cancer. My recovery was very swift, and all because it was detected early.
Every little piece of that trial was put together by our donors and supporters, and it is really important to thank them because without them we simply could not have done it.
The Leeds Lung Health Check was able to provide evidence that lung screening works in the real world, and that we had a good response to invitations. When the Leeds Lung Health Check finishes, then screening will be taken over by the NHS, and people will be invited for lung screening in the same way as they are now for breast screening and cervical screening. The plan is to have a national lung screening programme in Leeds by late 2024.
The Leeds Lung Health Check is a fine example of how we can save lives by offering people an earlier diagnosis. And there are many, many ways that that can happen, not just for lung cancer, for other cancers too. And Yorkshire Cancer Research is committed to finding those ways so that their chances of survival are greater.